Assalamualaikum warahmatullahi wabarakatuh to Ms. Jamhira and to all my friends. We are from AM2284H, Group 2. We'll be presenting to you our topic policy called National Strategic Plan for Tuberculosis Control. Before we started, let me introduce you to our team members. The first one is Muhammad HIQMAL HAKIMI. Moving on to our leader, Nur Anis Najwa. Next, Siti SYAKIRAH, AHMAD SYAIFUL ZAFRI, NURFATINI IZZATI, and our last member is NURUL AINA NAJWA. Therefore, this is table of contents for our presentation.
National Strategic Plan for Tuberculosis TB Control of Malaysia was a comprehensive initiative aimed at addressing the significant public health challenge posed by tuberculosis within the country. Malaysia has been grappling with TB for decades, and this strategic plan represented a concerted effort to combat the disease through a multifaceted approach. Before the implementation of the National Strategic Plan for Tuberculosis Control of Malaysia 2016 until 2020, Malaysia faced a significant burden of tuberculosis with a relatively high incidence rate. In the year leading up to the plan implementation, the country experienced a steady number of TB cases. Specifically, Malaysia was categorized as an intermediate TB burden country by the World Health Organization (WHO) prior to the implementation of the plan. This meant that the incidence rate of TB in Malaysia was higher than that of low burden countries but lower than that of high burden countries.
Policy problem.
First policy problem is an increase of TB cases in Peninsular Malaysia due to urbanization. Urbanization means that there are more people living in cities, towns, and other urban places than in rural areas. It was estimated that 2/3 of Malaysia's people, which is 76.4%, live in cities in 2018. Malaysia's urbanization has led to densely populated living areas. They are easy for TB to spread because they don't have enough airflow. When shopping malls, public transit hubs, and public parks open, they create places where a lot of people are together, which is good for spreading tuberculosis. TB cases slowly rose in the peninsula from 14,710 in 2010 to 17,065 in 2015. When looking at the years 2011 until 2015, the lowest number of TB cases and deaths in Peninsular Malaysia was 99, and the highest number was 4,747. According to records from 2011 to 2015, Selangor had the most TB cases, which is over 3,000, and deaths over 182 in the peninsula. Also, during the years 2011 and 2015, Perlis had the fewest TB cases, which is less than 200, and deaths which is less than 20. The states in the peninsula with the highest share of urban residents from 2011 until 2015 were Kuala Lumpur, Putrajaya, Selangor, and Pulau Pinang. And also, from 2011 to 2015, Kelantan had the lowest number of urban residents in the peninsula, which is less than 50%. Okay, based on the data, there will be more TB cases and deaths in Peninsular Malaysia as the population and number of people living in cities grow. In summary, the maps showed that from 2011 until 2015, we can see that a very high TB incidence and high urban population was in Selangor, and a very low TB incidence and a very low urban population was in Perlis. Actually, most of the states saw an increase in the number of people living in cities, but only Selangor state saw a very high increase in the number of people getting TB. This might be because Kuala Lumpur, which is Malaysia's capital city, and Putrajaya, which is Malaysia governmental hub, are both federal territories and are located in Selangor state.
The next policy problem is about difficulty to control tuberculosis or TB. Representing only 10% of Malaysians living in the state of Sabah in Eastern Borneo, the region, however, has a disproportionately high of tuberculosis cases between 20 and 30% compared to the national average. Sabah has been struggling to control tuberculosis or TB cases in the recent decades due to the case reporting rate has remained elevated at higher levels of 144 to 217 per 100,000 people, while rates have fallen in other parts of Malaysia. Reasons for the greater difficulty in achieving TB control in Sabah are still unclear. It is unclear how much the local epidemic may be caused by HIV, migration from high-burden areas in the region, treatment resistance, delayed diagnosis, high risk of smoking, diabetes and other causes. Migrants are thought to comprise approximately about 27.8% of the Sabah population. According to unpublished data from the largest hospital in Sabah shows an average of 63 new diagnoses of TB HIV co-infection and 15 deaths annually between 2010 and 2013. Therefore, although we recognize TB HIV co-infection as a serious problem in the hospital settings, accurate data of TB HIV co-infection in Sabah are still lacking.
Moving on to the last problem, which is undetected TB cases in Malaysia. TB detection in Malaysia is less than what the World Health Organization (WHO) estimated. In 2014, the WHO estimated 100 TB cases per 100,000 people, but Malaysia recorded only 81 per 100,000 people. This suggests that around 6,000 cases went undetected. It expected that the number of TB cases in Malaysia will keep going up from 40,000 in 1990 to 31,000 by 2030. When comparing predicted data from 1919 to 2010 with actual data from 1990 to 2014, it was found that on average there was a 30.49% underestimation of TB cases. A study on TB among prisoners in Malaysia shows that many had TB that wasn't previously diagnosed. About 7.7% of prisoners had undiagnosed active TB, and almost 2/3 of those with active TB were released from prison before finishing their treatment. Older age and HIV infection were also linked to active TB. In prisons, they use various ways to check for TB, and it depends on the resources they have. Most of the time, they rely on clinical symptoms to find TB cases, especially in the place with limited resources. But using symptoms alone may not be very effective in finding all the TB cases, and it might underestimate how many people actually have TB in prisons. If they only use the WHO clinical scoring system, it will have missed TB diagnosed, in which our case, we will have missed 61.8% of TB cases out of 34 cases.
Okay, now we move on to the objective and strategies for National Strategic Plan for Tuberculosis. There are 3 objectives and few strategies under this plan. For the first objective is to enhance case detection of TB. In order to achieve this, TB screening program will be made. But what is TB screening program? TB screening program is the systematic screening of high-risk group, including contacts of TB index case, TB HIV comorbidities, inmate for prison, diabetes patients, and smokers, and also elderly. So contact tracing is the one of the core activities and have been implemented in Malaysia to control TB transmissions. So by having this program, it will help the health workers to detect patients with TB in an attempt to stop its spread. Another strategy is by having a disease notification and surveillance system. Medical officers, regardless in private or public healthcare facilities who has diagnosed or had treated patients with anti-TB medications are mandatory to notify the case to the nearby district health office in Malaysia. And then the patient will be registered to the electronic web-based application which called My TB system. So this system comprises of variables such as on patient's social demographic, laboratory investigation, anti-TB treatment regime, treatment outcome, and list of contact of index of TB patient. And then for the second objective for National Strategic Plan of Tuberculosis is to improve the management and treatment of TB. So we apply a strategy by directly observed treatment, DOT, which is a treatment using a patient-centered case management, including directly observed therapy, when treating persons with TB disease. DOT means that a trained healthcare worker or other designed individual, including family members, provides the prescribed TB drugs and watch the patient to swallow the medication. So DOT can help patient finish the TB treatment without gaps and then prevent TB spreading to others and also decrease the chances of treatment failure and relapse. There is also another strategy under the second objective, which is BCG vaccination program. BCG is a leaf attenuated vaccine against tuberculosis, and then BCG vaccines is normally given to children as it has been shown to provide 70 to 80% effective against the most severe forms of the disease, such as TB meningitis in children. So protection has been shown for the last 20 years. So this strategy is important as an early preventive measures from the spreading of TB. Okay, now we move on to the third objective, which is the last objective for National Strategic Plan for Tuberculosis, which is to enhance government stewardship and accountability in pursuing TB policy across government agencies. So for the first strategy applied under this objective is by having an uninterrupted supply of quality assured TB drugs by providing free medications. So free medication will be provided to patients treated with first-line anti-TB drugs at all MOH hospitals and clinics. So procurement of all anti-TB medicine is done by the pharmacy department or unit at hospital and district levels using the existing operational budget. And then another strategy for this third objective is by providing counseling on TB medication. So this strategy could enhance patients' adherence by increasing the patient's understanding about the importance, side effect of treatment, as well as handling those side effects. So especially the pharmacies are expected to have more active involvement in educating the TB patient about their medications, because TB patients frequently suffer from adverse drug reactions. So by providing this counseling on TB medications, this will enable appropriate measures being taken to ensure a safe treatment. The last strategy under the last objective is by addressing poverty and social determinants by promoting HIAP approach, which is held in all policies. This will refer to TB patients with low socioeconomic income to receive financial aid from MAPTB or Social Welfare Department or Pusat Zakat by mapping of risk factors and local social determinants, and also revised criteria for the eligibility of receiving TAS Treatment Allowance Scheme and EGT Allowance Ganti Tambang. And this strategy is as a social protection mechanism to support patients and families that are affected by TB.
Policy evaluation.
Now let's look at the policy evaluation. The evaluation of the first policy problem is in terms of strength. Okay, the strength is the prevalence of smear positive TB remained relatively stable and increased marginally from 2013 to 2017. Okay, this evaluation is focusing in Gombak, Gombak is one of the administrative districts in Selangor. Selangor is in Peninsular Malaysia. Selangor is chosen because Selangor was identified as one of the states that have a lot of TB cases. The Selangor state was noted to have the highest number of TB cases, which is greater than 3,000, and death greater than 182 in the peninsula for the whole duration of 2011 until 2015. Okay, so for the evaluation is the number of smear positive TB cases stayed pretty stable from 2013 to 2017. Going from 306 to 382. The number of TB cases slowly went up from 2013 to 2015, mostly because there were more smear positive TB cases. On the other hand, the number of smear positive, smear negative, and extrapulmonary TB cases slowly went down from 2015 to 2016. There were 5 years of data from each mukim in Gombak. And figure 4 shows how incidence rate which change over time and space. Batu, which is one of the mukim in Gombak, had the highest average number of TB cases, which is 91.72 cases per 100,000 people, followed by Hulu Kelang with 87.24 cases per 100,000 people. The area with the lowest average number of TB cases was in Setapak, with 55.4 cases per 100,000 people. The main reason for the slow rise in TB cases was the rise in the number of smear positive cases. But people with smear negative TB also made up a quarter, which is 24.23% of all TB cases. Even worse, if they didn't get treatment, half of them might turn into smear positive TB. To fix the problem of waiting too long to diagnose and let people know about smear negative TB cases, the government has been stepping up efforts to cut down on these delays. When it comes to high-risk areas, expanding prevention steps might be hard. It's possible that the Ministry of Health Malaysia's effort to avoid and control the disease was successful because there wasn't a clear peak in any of the years that the study was done. The lack of a trend in time over the course of a year was similar to what was seen in nearby countries like Thailand, Indonesia, and Singapore. In Malaysia, the weather is always hot, wet, and rainy because the country is right on the equator. The steady pattern of TB cases over time was likely due to the temperature in the area.
The next trend of this policy is there are decreases in TB cases in Sabah. Between 2012 and 2018, there were about 33,193 TB cases were reported to the Sabah State TB Surveillance Database, and there was a slightly positive result in controlling TB cases in 2018. From 2012 to 2018, about 83% of the drug-sensitive TB cases had successful treatment. Furthermore, the proportion of total cases that were children decreased by 2018. Only 1.2% of cases were less than 5 years and about 3.6% were less than 15 years.
Okay, now I'll talk about the weakness in this policy evaluation. Even though we have strength before this for the first policy problem, however, we identify that there is a weakness that we evaluate from the first policy problem. Okay, the weakness is Selangor prisons have the most TB patients. Inmates with TB were found in 405 people in 4 Malaysian states, which is Penang, Sarawak, Sabah, and Selangor. There were 312 prisoners from Selangor, which is 77%, 71 from Penang, 17.5%, 12 from Sabah, 3%, and 10 from Sarawak, 2.5%. There were 440 out of every 100,000 prisoners who had TB. The rate of TB in 4 states of Malaysia is 440 over 100,000, which is very high compared to the highest rate of 290 over 100,000 in Italian jails. The number of cases of TB in Selangor State Jail was 755 over 100,000, which is 175.59% higher than the overall rate of 440 over 100,000 cases of TB among Malaysian prisoners. Only 8 of the 405 inmates in those 4 states were women who had TB. Female prisoners with TB were only found in Selangor State, which indicates that additional investigation should be conducted into the specific circumstances that led to this high incidence rate in that situation. This jail may have a high TB rate due to overcrowding and poor sanitation. The high risk of TB among convicts is due to overcrowding in each unit, and the rooms are maybe dark, poorly lit, and overcrowded. All buildings lack sewage systems, making the condition unsanitary. Therefore, the prison may be subjected to many health issues.
The other weakness of this policy is due to geographical factor. Despite Sabah representing only 10% of Malaysia's population, the TB burden remains disproportionately high in Sabah compared with Peninsular Malaysia. This is due to there being hotspots of TB in urbanized population hubs and points of migration, as well as evidence of late presentation and diagnosis. In 2018, 30% of incident TB cases were believed to have gone unnoticed, and after 2018, the case notification rate in Sabah was 47% higher than that of the national case notification state of Malaysia. One of many reasons is due to the geographical area in Sabah. Sabah shares a porous border with the Philippines on land and at water, has a complicated hinterland that makes access to the healthcare challenging, and is home to sizable informal settlements inhabited by marginalized population. Furthermore, there were geographic hotspots of disease, particularly the district of Semporna, Pitas, Kota Marudu, Tuaran, and Kota Kinabalu. These districts correspond with areas of frequent cross-border movement between Malaysia and the Philippines, such as Semporna and Pitas. Therefore, the presence of a high number of tuberculosis or TB cases among non-citizens in certain geographic area of Sabah, Malaysia, as well as the occurrence of TB cases among overseas-born individuals several years after their arrival in Sabah, suggests that TB may be locally transmitted. These local transmissions might initially have been introduced through individuals who acquire the disease overseas.
Lastly, the witness of undetected TB cases in Malaysia happened because of delay in treatment, which led to death. About 1,500 to 2,000 people die from TB in Malaysia every year, with approximately 6 deaths daily. The head of the TB and leprosy sector at the Health Ministry's Disease Control Division, Dr. Muhammad Naim Abdul Kadir, revealed that Malaysia sees around 20,000 to 25,000 new TB cases each year. Many deaths occur mainly due to the delay in seeking medical treatment. Comparing TB to the dengue, another contagious disease in Malaysia, TB has a higher death rate. While there are about 50,000 to 100,000 dengue cases annually, only around 100 deaths are recorded. However, for TB, there are 20,000 to 25,000 new cases each year and 1,050 to 2,000 deaths. Dr. Muhammad Naim also emphasized when TB isn't diagnosed and treated quickly, it will get worse, also can lead to the death, and increases the risk of spreading the infection to others, especially those who are close to the infected person. The delay in finding and treating TB means more people in society can catch it. Untreated patients with TB can infect an average of 10 people each year and about 20 over the course of the disease.
Today I will explain about the recommendation for the witness of this policy. First is effective TB prevention in prison. Control measures in prison and jail include finding people with TB disease early on through entry and regular follow-up screening, treating TB disease and latent TB infection successfully, and making sure that the right airborne steps are taken. The next recommendation is for geographical factor in Sabah contribute in TB. First recommendation is cross-border cooperation. Malaysia and the Philippines should take initiative to enhance their cooperation and information sharing between their countries. This can help the country to treat cases that cross the border, and the country can take immediate action. Next recommendation is improve the screening and monitoring. The government of Malaysia can take yearly action by implementing mandatory TB screening for non-citizens, especially during the immigration process or when seeking work permit or visa. Last recommendation is collaboration with the international organization. The government can collaborate with international organizations such as World Health Organization (WHO) to gain access and information on how to overcome the non-citizen that have the TB. The last recommendation is for delay in treatment lead to death. First recommendation is streamline referral system. Develop effective referral system that facilitate the smooth transition of TB patient from primary healthcare facility to specialized TB treatment center. Next recommendation is diagnostic tests. Implement advanced diagnostic tests for both TB and pneumonia and ensure they are widely available. Rapid diagnostic tests like the Gen Aspect test for TB can provide quicker results. Next recommendation is imaging. Chest X-ray and other imaging techniques can help distinguish between TB and pneumonia. TB often present with specific radiological features like cavity and infiltrates.
The National Strategic Plan for Tuberculosis Control of Malaysia likely ended because it was a time-limited initiative designed to address specific goals and objectives over a defined period. Because of the policy was made only for 5 years time frame, once the plan implementation period ended, authorities and stakeholders likely conducted an evaluation to assess the plan achievement and shortcomings. There will be more TB cases and deaths in Peninsular Malaysia as the population and the number of people living in cities grows. Last but not least, the policy was really good to combat tuberculosis, but because of the time ended, the national plan might be improved and improvised in a better way. So that's all from us.